Hello, everyone. I am Charlie Tolhurst, and welcome to your COVID-19 pandemic podcast for today. There'll be a brand new here that I am going to do on coronavirus. Now, I am live on Facebook and YouTube tonight for this podcast. Please tune in now if you want to hear all the latest news. Please also feel free to comment down below and ask me any questions. This is going to be covering the week's biggest news stories, and there is certainly a lot to get through tonight on the news, particularly over in the UK at the moment as well. I just want to say to everyone, hello everyone, I am Charlie, and of course, welcome to this podcast live on Facebook and YouTube. I'm just saying this now, the COVID-19 pandemic podcast is live at the moment on Facebook and YouTube. Please tune in right now if you want to hear all the news. So we're going to start quickly with the figures for today's coronavirus data, which I am just getting in now from the UK government. And in the last 24 hours, 6,003 newly confirmed cases of COVID-19 were detected in the UK. That is still down, though, from the week before. The total number of positive tests in the UK now stands at 4,280,882. That is 4,280,282 new confirmed, that total confirmed cases of COVID-19 in the UK. Patients admitted to hospital in the last 24 hours was a total of 426. The total number of patients in hospital in the United Kingdom with COVID-19 stands at 7,218 and keeps falling as we speak. And I believe hospitalizations are down about 86% from the peak in January. So very interesting to see that drop. And that's a very encouraging fall as well. We really want to see the vaccinations working. I'm going to go over the data for daily deaths now. Sadly to report, in the last 24 hours, a total so far of 125,926 people in the UK have sadly died after testing positive for COVID-19. This is within 28 days of a positive test, just to let you know. The total number of deaths in the UK from COVID-19 since the pandemic began was 195,926, an increase of 95 fatalities yesterday. I mourn the loss of all these all of these people. These are it's a family member, and we grave the loss for all these victims. However, though, the deaths are definitely a lot lower than what they were at the peak in January, and that shows you the vaccinations are really starting to kick in. So I'm going to now go over to vaccinations, and I'm going to be talking a lot about vaccinations in tonight's podcast anyway. A total of 25,735,472 people have received a first dose of the COVID-19 vaccine in the United Kingdom. That is 25,735,472 people in the UK have received the first dose of a COVID-19 vaccine, which is actually a very good number indeed. 25 million. That's much better than what we're seeing in the EU, and where they're very low at the moment. So that's all the figures for you now. But we're going to move on to the biggest talking point of the podcast tonight. And I want to talk about the Oxford AstraZeneca COVID-19 vaccine, which has been dominating the news this week. Now, the reason why I'm talking about it now is because this is quite significant. Now, a number of EU countries this week, or a number of countries across the EU and across the world, have actually paused the rollout of this vaccine. And the reason why they've done this is because there's believed to be some cases of blood clots caused by some patients in this vaccine. So a few people have died by what's been reported. These are people who have had reported to have blood clots from the Oxford AstraZeneca vaccine. Now, I honestly want to say that this is very crazy news indeed. The EU are being very vindicative with this, I have to say. because the Oxford AstraZeneca vaccine is a safe and effective vaccine, and a lot of the EU countries have suspended the rollouts. Now, we know Italy are going to start using it again tomorrow, but after the European Food and Medicines Agency actually said that there was no evidence to suggest that the vaccine causes blood clots. Yes, vaccines do cause side effects now and again in some people, but that's true of any vaccine. It's the same with the flu one. So I think at the end of the day, this comes down to party politics between the EU and the UK. And what the EU done the other day, Ursula von der Leyen threatening to block exports of the Oxford AstraZeneca vaccine, was crazy. And I have to say, for a lot of people watching this podcast tonight, you might think this sounds a bit crazy, don't you? But what we've seen from the EU is absolute craziness from them. Oh, a number of countries have just suspended the rollout, and we know vaccines save lives. A vaccine is what is going to get us out of this pandemic. Take the vaccine, guys. I'm urging you now. Taking a vaccine will save many thousands of lives. It will save someone's life by taking the jab. And what we're seeing from the EU is muchly resurgence of the virus. Cases are rising across many EU countries. Italy has announced that many regions of its country will be placed under what's called a red zone stage, which is basically the toughest level of restrictions. And in most of Italy, that means schools closing and hospitality closing, like pubs, bars, restaurants, all them things, and also non-essential retail having to shut, basically putting them areas back into a full lockdown. And the new UK variant over there has taken off, and the new variants are just ripping through Italy. Lombardy, the region of the north, hit hard by the pandemic last year once again, and it seems like a third wave has hit Europe right now. Whilst here in the UK, the vaccine rollout is going very tremendously indeed, and is a success. We've vaccinated over 25 million people in the UK, whilst compared to France, it was only the other day, which is probably slightly higher now. But this news, with countries pausing the rollouts of the Oxford AstraZeneca vaccine, which is the vaccine that they rely on the most, other than the Pfizer vaccine, which has to be stored at minus 70 degrees, which means that one's very more difficult to produce, means that they're in a lot of trouble. France, Germany, countries are seeing resurgence of the disease. Cases are rising in many of these countries. Thankfully, here in the UK, they seem to be either plateauing or falling, which is much different. And we are in a much stronger position in the EU. After lockdowns last year, it seems like now there is a lot of problems that the EU are facing like we faced last year. So that has been the row and the scandal in the EU. At the moment, Dominic Raab took to the Foreign Secretary, actually had an interview the other day, Dominic Raab, who's the Foreign Secretary of the UK government, and he said the EU are acting like a dictatorship over vaccine supply. I think it is clear that the EU are having a nightmare. He called the EU's stance is brinkmanship. So, yeah, I think that's very clear. So that's the first thing over the EU. Then we're going to talk about the press conference today. So Boris Johnson announced that he will be getting the Oxford AstraZeneca vaccine tomorrow. Good luck to the Prime Minister for getting his jab. And I will be covering a lot more of that when Boris Johnson receives his vaccine. I'm sure there'll be lots of social media posts on Boris Johnson's page as well. Now, Boris Johnson held a press conference over potential over this issue of the COVID-19 vaccine supply. Now, there is going to be a bit low of a supply in obviously in April. There's going to be some supply issues. Of course, there's vaccines coming over from India that are going to be delayed. There's a batch or a shipment of 1.7 million doses of vaccines that were going to be sent out to be retested. And I find that quite bizarre. Now, However, though, the Prime Minister did reiterate, though, that we're going to have more vaccine supply in than we did in February. So when we look at the vaccination data in February, we were averaging sort of 275,000, 300,000. And over the last few days, we've gone up to sort of 386,000, 400,000. I do expect those numbers to fall slightly next month. So we're sort of probably going to be looking at around 500,000 a day, which is still a decent amount. But we aren't going to be vaccinating as fast. But the main thing is what the NHS want to do is to vaccinate the top 9 cohorts by the middle of February. Or middle of April, sorry. People, that's... Now, just to confirm with you, what the JCVI COVID prioritization list. Anyone who group 6 to 9 is as the following states, which is group 6 is all people who are aged between 16 and 64 who have an underlying health condition. So I'm actually going to go over that now whilst we're here. So number 6 is high risk. 5 to 9, sorry, I'll read them out again, is all those over age 65. Number 6 is high risk adults under the age of 65. So people who are sort of 16 to 65 who have an underlying health condition, and also disabilities and also other health conditions such as asthma. Moderate risk adults under the age of 65. Number 8 is all those over 60. Number 9 is all those aged 55 and over. And number 9 is aged 55 and over. And priority group number 10 is, of course, all those 50 and over. Now, priority group 9, of course, that being is all over 50s. Now, as Chris Whitty said today in the Downing Street press briefing, the government are focusing heavily on those who are over the age of 50. And we really want to make sure that we are getting the vaccines out to people as fast as we are possibly doing, because we want to save lives. It's very, very important that people really just stick to the rules whilst they're right now, but also take the vaccine, please. It is so important. I'm stressing now, the vaccines do save lives, and I think it's very clear that we have to be very we don't want to be complacent about this. So this is what the Prime Minister Boris Johnson had to say today, as he vows the roadmap to freedom will not be delayed despite the AstraZeneca jab fears. So here is the Prime Minister of the United Kingdom, Boris Johnson, speaking at the number 10 press conference this afternoon about vaccine supply issues. Have a listen to this.
Our roadmap to freedom depends on the continued success of our vaccination program, and so it's reasonable for people to want to be continually reassured, not only that our vaccines are safe and effective, but also that we have the supply that we need. So I want to address both points today, especially in the light of concerns you may have heard in some other countries about the Oxford AstraZeneca vaccine. First, the Independent Medicines and Healthcare Products Regulatory Agency has reviewed the evidence, as it does every week. They've confirmed that the benefits of the vaccine in preventing COVID far outweigh any risks, and people should continue to get their vaccine when asked to do so. And June will say a little bit more about that in a moment. It's also very important for our European friends that today the European Medicines Agency has come to a clear scientific conclusion, and I quote, "This is a safe and effective vaccine." We also saw yesterday the evidence from Public Health England that a single dose of either vaccine provides 60% protection against getting COVID and reduces the chances of hospitalization by 80% and the risk of death by 85%. So the Oxford jab is safe and the Pfizer jab is safe. The thing that isn't safe is catching COVID, which is why it's so important that we all get our jabs as soon as our turn comes. And as it happens, I'm getting mine tomorrow, and the centre where I'm getting jabbed is currently using the Oxford AstraZeneca vaccine for those receiving their first dose. That is the one I'll be having. And let me also assure you, if you come forwards after receiving your letter, we have the jabs for you. We've always said that in a vaccination program of this pace and this scale, some interruptions in supply are inevitable. And it is true that in the short term, we're receiving fewer vaccines than we had planned for a week ago. That is because of a delay in a shipment from the Serum Institute, who are doing a Herculean job in producing vaccines in such large quantities. And because of a batch that we currently have in the UK that needs to be retested as part of our rigorous safety program. So as a result, we will receive slightly fewer vaccines in April than in March, but that is still more than we received in February. And the supply we do have will still enable us to hit the targets we have set. That means that by the 15th of April, we'll be able to offer a first dose to all of you who are over 50, as well as those under 50 who are clinically vulnerable. We will have the second doses that people need within the 12-week window, which means around 12 million people in April. And we will still offer a first dose to every adult by the end of July. So there is no change to the next steps of the roadmap. We've now vaccinated over 25 million people across our entire United Kingdom, more than the entire population of many countries, and our progress along the road to freedom continues unchecked. We remain on track to reclaim the things we love, to see our families and friends again, to return to our local pubs, our gyms and sports facilities, and of course, our shops. All, of course, as long as the data continue to go in the right direction and we meet our 4 tests. And the way to ensure that this happens is to get that jab when your turn comes. So let's get the jab done.
Thank you there to the British UK Prime Minister of Britain, Boris Johnson, the leader of the Conservative Party, addressing the nation on COVID-19 vaccinations as well. Chris Whitty also reassured the public that the vaccines are safe and effective, especially the jabs from Pfizer and also the Oxford AstraZeneca COVID-19 vaccine. I mean, wow, they're very, very important. So that is the news on the vaccine rollout. Now, I just want to quickly mention about some more news that came out of today whilst we were here. And this news is going to be to do with shielding related with COVID-19. So now I'm going to just give a message here to anyone who's extremely clinically vulnerable, or clinically extremely vulnerable have been asked to shield throughout this lockdown. And I know how tough it is for many of you people. I know the fear of going outside, not being able to go to work. It is very difficult. However, though, there will be changes coming to the shielding guidance. Now, from April, the shielding advice will be expired. It will expire on the 1st of April. From the Thursday, the 1st of April, 2021, 3.79 million clinically extremely vulnerable people in England will be informed that they're no longer advised to shield. Now, people on the shielded patients list will receive a letter from today with updated guidance on steps that they can take to reduce their risk. More than 9 in 10 clinically extremely vulnerable individuals across this country and across the UK have been vaccinated with a first dose of the COVID-19 vaccine. So, the Deputy Chief Medical Officer for England, Jenny Harris, said that shielding has been an advisory measure and it's measured to safeguard those of the most vulnerable in the communities. We recognise how difficult period is and impacting people's well-being. With the prevalent virus continuing to decrease, now is the right time for people to start thinking about these real guidelines. So from the 1st of April, people who were shielding will now follow the national guidelines, the national measures that are in place as well. So, yes, very interesting news. I know a lot of people who are extremely clinically vulnerable are struggling financially. I know a lot of people having to apply for statutory sick pay. Some people are still on furlough. That is the advice from gov.uk that from the 1st of April, shielding in England will expire. And that will be at the end of this month. It's so important, guys, that that there will be that rule will be reduced. Matt Hancock has announced as well. The Health Secretary has announced that it will end on the 1st of April. That is the rules on shielding. So yes. So this is what Matt Hancock, the Health Secretary, had to say today in the House of Commons. Have a listen to this.
Has halved in just the past 16 days. And thankfully, the rate at which people are dying has fallen by a third in the last week. As a result, I can tell the House that we are, from today, writing to all those clinically extremely vulnerable people to let them know that shielding will come to an end on the 31st of March. I want to thank all those who've shown such fortitude and all those who've done so much to look after the most vulnerable. The shielding programme truly has been Britain at its best, pulling together to help those most in need. The rate of hospitalisation.
Thank you to Matt Hancock there, the Health Secretary, for that announcement. So that was announced during a sitting of the Health and Social Care Department statement in the House of Commons earlier today as well. So that is the UK news. Are you there? Now it's time to talk about general COVID-19 news now, and is the latest news, and I have some news for you concerning France. And Paris is going to be among 16 French regions set to go into lockdown for a month from tomorrow midnight. France has tried to avoid imposing lockdown measures, but forced to change direction with tens of thousands of cases a day. Paris, which is among 16 regions of France facing new lockdowns from midnight tomorrow, the country's Prime Minister Jean Castex has announced. The measures will be in place for at least the next 4 weeks and will be less restrictive than those seen in March and November. Schools will remain open and outdoor activities will be allowed to go ahead. However, though, they must be within a 10-kilometre radius of someone's home. However, though, in terms of other parts of the economy, non-essential shops, not including bookshops, will be required to close. Inter-regional travel will be prohibited, and a nationwide nightly curfew will be moved back an hour to 7 p.m. local time, which is 6 p.m. Greenwich Mean Time. French authorities have gone great lengths to avoid reimposing restrictions, and France is very clear that they are having issues with the vaccine rollout. And if you just want to have a look at France's coronavirus statistics here, just on how the number of new cases has been, France the other day saw around 38,000 new infections. However, though, a country that is struggling, and I'm just going to cover that now, is Brazil. Brazil have been very big this week when it comes to COVID-19, as the health service faces its worst crisis in history, as more than 90,000 new cases were recorded in Brazil in the last 24 hours alone. Wow, huge totals in Brazil. In Brazil, Manaus's hospitals once again have been overwhelmed. The Brazilian variant has just taken off and destroyed the health service. COVID-19 units in 2 of Brazil's 27 states are above, apart from 2 states are above 80% capacity. In Rio Grande do Sul, there are no intensive care beds at all. The warning came as the country recorded another horrendous milestone, 2,841 deaths, a horrendous death toll in Brazil. My thoughts are with all those who've lost loved ones. And this is a horrendous wave in Brazil. Another health minister will be appointed. Jair Bolsonaro has fired another health minister, Marcelo Quigor, if I pronounce his name there, Marcelo Quigora will be formally appointed health minister later on Wednesday. In other words, he is now the new health minister of Brazil. However, though, there have been lots of protests in Brazil. You can see a photograph here of a protest taking place in Sao Paulo as fans have gathered, as protesters have gathered in huge crowds to protest against lockdown measures, as Jair Bolsonaro continues to downplay the threat of the virus, calling it still a little flu, and stop whining to the Brazilian public. However, though, the Sao Paulo governor, João Doria, said that President Bolsonaro has been too late to order vaccines, and he said hashtag we need vaccines if we're going to get out of this. So it's very clear that the Brazilian government has faced issues as well, distributing its Oxford AstraZeneca vaccine, a Chinese-developed coronavac jabs, and has placed orders for the Pfizer-BioNTech Johnson & Johnson vaccine, and also Russia's Sputnik V vaccine, which has not undergone any major clinical trials yet. So only 4.6% of the population of Brazil. It's very clear that President Bolsonaro is coming under criticism. And its third health minister is going to go. Jeez. 3 health ministers within a space of a year for Brazil. Not great, if I'm honest with you. So that is Brazil. I'm now going to finally turn to America, the United States. And Anthony Fauci warning of a potential surge over there in the United States. However, though, there has been some news from former US President Donald Trump, who actually is urging Americans to have the jab, including urging his supporters to get vaccinated. Now, the former president, President Trump, said during an interview on Fox News that he said the jab is safe and it needs something for people to work, and it's safe and something that works. Mr. Trump acknowledged people were free to decide themselves whether they want to be vaccinated from COVID-19. He said, we have our freedoms and we have to live by it and agree that also. But with a great vaccine, it's a safe vaccine and it's vaccine work. It found just 42% of Republicans, so definitely not have the job, compared to 17% of the Democrats who said they'd have the jab. So yeah, it came as Joe Biden got his first vaccine last year. So, I mean, it's very interesting. President Donald Trump there giving a very important public reassurance, and to all of his supporters, please have the jab. Like, honestly, we have to be truthful here that Donald Trump really wants to see his fans having a jab as well. It's really, really important as well. So we really want people to get their jab. And Donald Trump actually spoke yesterday on Fox News as well. And this is what the former US president had to say on Fox News the other day. Have a listen to this right now.
Better than they've ever seen on the southern border. The wall is almost complete. We just had to fix little sections, complete little sections that a month, and it would be just magnificent. It already is magnificent.
I want to get your take on President Biden's agenda, including the border, but also this stimulus package, the idea that we are on the doorstep of much higher taxes. What would be the impact, in your view, on an economy that is just beginning to recover?
Well, it was recovering under my administration twice. We got it to a level that the world has.
Here's President Trump talking about Operation Warp Speed.
Getting any credit for any of this by the Biden administration. In fact, even when it comes to the border, Nancy Pelosi this weekend said that the Biden administration inherited the border issues from the Trump administration.
So when you go to the COVID issue, we did a great job. We get very little credit for it. I closed the country far earlier. Dr. Fauci and Birx and all of these people that frankly made nothing but mistakes. They didn't want to do it. They didn't want to close it to China. I closed the border to China. I closed the border to Europe, Italy, and all these countries that were having tremendous problems long before they wanted me to do it. And if you look at Biden, he didn't want to do it months afterwards. And then ultimately he admitted that he made a mistake in saying that. If I didn't do that, we would have had hundreds of thousands of more lives gone. But the big thing is I've always felt it was the most important is the vaccine. The key was always going to be the vaccine. And when Biden got the vaccine in December, and he made a statement that he doesn't think we have vaccines. Now, I don't know, did he make that statement as a statement or did he not actually know we had the vaccine? What's going on there? But he got his shot. He got his first shot in December 21st, I believe. So with the vaccines and with the job we've done with COVID, I inherited an empty cupboard. Biden failed very badly with the H1N1, as you know, he had a chance to do something, and they had a tremendous failure. H1N1, it was a disaster. And now he's taking over this. What he's taken over, warp speed, we had it, our military, what they've done in terms of delivery has been incredible.
Yeah.
And we gave up to 1.3 million shots a day before he even took over. So not only did we have the vaccine, and one thing we did, we took a big bet on this. We started manufacturing the vaccine before we really knew it worked. We saved many months and millions of lives by doing that, because you wouldn't have the vaccine right now if we didn't take that chance. We knew what we were doing. We knew that we felt strongly it was going to work. And we took a risk, and the risk was spending billions of dollars to develop it before we knew and before we had the approval that it was going to work. It works incredibly well, 95%, maybe even more than that. It works incredibly well. And it's really saving our country, and it's saving, frankly, the world.
So, Mr. President, I know that you received the vaccine. Mrs. Trump also got the vaccine. Would you recommend to our audience that they get the vaccine then?
I would recommend it, and I would recommend it to a lot of people that don't want to get it, and a lot of those people voted for me, frankly. But, again, we have our freedoms, and we have to live by that, and I agree with that also. But it's a great vaccine. It's a safe vaccine, and it's something that works. And we've been working round the clock, and when I got the FDA to do this would have happened. This would have happened in many years from now if I didn't get involved, and if we didn't get involved.
Yeah, tell me more about that. I remember you were talking about when you were in office, you were talking about the meeting that you held with the major pharmaceutical company heads, and you were garnering all of their support to work together to ensure that a vaccine was on the market as soon as possible. And you said that one issue that you were trying to do was to alleviate any bureaucracies within the FDA. How was it that you were able to encourage a vaccine on the market within 9 months? That was quite extraordinary.
Well, I wouldn't say the FDA loves me, but I pushed them very, very hard, harder than they've ever been pushed. And a number of the people in the FDA admitted that, and at the end they were very happy. But they did not like me. In fact, they wanted to announce it sometime after the election because they just didn't. I think most people knew we pretty much had the vaccine before the election, but they wanted to announce it along with the drug companies who are not fans of mine, because if you look at favored nations and all of the things I've done to bring down drug prices, nobody's ever done what I've done. But that cost the drug companies a lot of money. In fact, they took tens of millions of dollars of commercials. So they wanted to announce the vaccine after, and I understand that, but somebody had to do it. You will see drug prices. If Biden leaves it alone, you will see drug prices. Favored nations means we get the price of the lowest nation. Whoever pays the lowest, we get that price. Right now, we're the highest in the world. We will be the lowest in the world, meaning tied for the lowest in the world. The drug companies were very unhappy with that. They never thought anybody would do it, but I did it. So with the vaccine, I pushed the FDA at a level that they've never been pushed before, and they got it done in 9 months instead of 5 years. Now, the 5 years I think would have never happened because I don't think they would have ever gotten it done.
Thank you there to former US President Donald Trump there talking about Operation Warp Speed on COVID-19. Also addressed the issue as well earlier on the borders that Joe Biden was talking about last week as well, as part of his manifesto plan as President of the United States at the moment. Well, what do I react to that interview? Yeah, Trump urging his supporters to take the vaccine. I recommending it like Boris Johnson today to the UK, recommending that the vaccines are safe and effective and people should take them to help massively save lives. And I just want to, before I wrap this podcast up tonight, I just want to give everyone, all the listeners out there, a message to the vaccine. Please take the vaccine, guys. It is so important. It will help you save many lives. The effects of having COVID are a lot worse. And according to the Prime Minister today, there is a quote that Boris said, benefits firmly outweigh the risks. It means the benefits of the vaccine firmly outweigh the risks posed by COVID. If you get COVID, it isn't a very nice disease. If you have the vaccine, it reduces your chance of getting hospitalized by over 80% after a single dose. So it's huge, 85% against death after a single dose, and that will most likely go up to 100 once you've had the second shot of the vaccine as well. Obviously, the Johnson & Johnson vaccine is only a single shot. So, yeah, that is very important. So, please, guys, take your vaccine wherever you can. It is really, really important. However, though, that is all we've got time for tonight on the COVID-19 pandemic podcast. Thank you so much for watching, everyone. And stay safe out there. Take care, everyone. Good night.